Hello, everyone. This is Cole from the American Journal of Healthcare Strategy, joined by a very special guest today. I'm sure many of you know and follow him on LinkedIn, Geoffrey. Geoffrey, please introduce yourself.
Yeah, Cole, thank you for having me. Geoffrey Roche, have the privilege of serving as the North America Director of Workforce Development at Siemens Healthineers.
It's a really interesting role, and you have so much experience on your LinkedIn. I was looking, over it. You are a podcast host. You're getting your doctorate. You have been in this healthcare industry for so many years and touched so many people. I have to ask, what got you started in this many years ago? What motivated you to go into the healthcare space?
Yeah, so I always say I always credit my mother, right? So for those that are familiar with me on LinkedIn, I do obviously go by as the son of a nurse, and there's a reason, there's a reason for that. Without question, my mother was a huge influence on what interested in me and also attracted me to want to serve in healthcare. And through that, when I was a college senior, actually, I did an internship in healthcare, and that was after I thought I was going the political route. So to your when we were earlier speaking, right, I'm a political science major in undergrad, and so I truly thought I was going the policy political science route. I had done internships on the Hill, did a lot of work, in state government. Actually had paid jobs during high school and college, and really thought that was where I was going. And then when I did this internship, it sort of brought me back to my childhood where I saw my mother work as a nurse. In fact, my mother graduated to become a nurse when I was 5, and so and then she raised my brother and I as a single mom. And what I always saw was this passion that she had to help and serve others. And then growing up, I always heard people that I was growing up with talk about, oh, my mom had your mom as a nurse. We just had our other another child, and your mom. My mom was a labor and delivery nurse, and so she sort of knew everyone in the community, and so it was sort of a very special upbringing. And then when I entered hospital administration in June of '08, obviously that was also an interesting economic time. So I was blessed and fortunate to have gotten a great job to start my career. I saw truly the opportunity one has in administration. And really the fact that if you have good leaders, you have a good environment, you can really set yourself up with great support for a phenomenal career. And so I was really blessed to have had that opportunity.
So it is interesting though, because you clearly were extremely successful in the political realm already before even graduating. Was it challenging to make that switch? I mean, what? Because it must have been a little scary, right, to switch over.
It was challenging from the perspective that, keep in mind, right, politics is always local. And so
Mhm.
when I applied for that hospital administration job, I was a very active individual in that area. And I will never forget, in fact, when I applied, one of the questions that was posed to me in the interview was, we know you've been politically active in this area. In fact, we've heard from one of our state representatives that you actually actively campaigned against him. How will you be the face of the hospital system from a community relations standpoint and not ever put us in jeopardy of choosing one side over the other?
Mm.
And, I can remember sitting there and thinking, wow, I'm not getting this job, obviously. There's no way I'm getting this job. And keep in mind, in a job like that, I mean, I started as the hospital spokesperson. I was responsible for all the relationships between, the chamber and elected officials and, all aspects of sort of how do you be the eyes and ears and voice of the healthcare system. Those things are important. So it was not easy, but I'll tell you, that same individual who obviously had shared that experience back in my early days of me working against him, later presented an award to me in our community on the work that I was leading at that healthcare system.
Wow.
And about a year into my work, he said to the same vice president, or I should say senior vice president, who posed that question in the interview, boy, have I been proven wrong. And not only have I been proven wrong, look at the results he's having. And so, I learned that when you come into a healthcare system, you're going to deal with politics just like you do when you're in politics. But what's most important is to keep your eye on your patients and keep your eye on all those around you that you're serving. And so I learned quickly in a maturity factor that I no longer could play one side or the other, but in fact, I needed to play what was in the best interest of our healthcare system. And so, an example of that was one of the first challenges that our CEO at the time gave me was, hey, look, the former president and CEO of the healthcare system pissed off the congressman of this area. I know you interned for that congressman. Your job is to get him here. And I remember thinking, oh my, like that's a daunting task just to get a member of Congress to a healthcare system when there's 25 other healthcare systems in his district or more is not easy. But I also know the congressman and I knew who he was. And I certainly knew when he was, when he was frustrated with something, that wouldn't be an easy task. So, I worked on it and, I had built those relationships with the deputy chief of staff and the chief of staff and the district director. And I remember when I first called them and said, look, it's a new CEO. I'm here. We'd love to get him here. But I also know he's busy. And keep in mind, it was the economic downturn of 2008. And so this was a member of Congress who was literally the number 2 in the U.S. House on financial matters, next to Barney Frank, Congressman Barney Frank. Many people remember Dodd-Frank. And so Congressman Kanjorski is his name. And I remember when I got the call a couple months later and they said, hey, the congressman's coming. He's not going to come to talk about healthcare, but he does want to do a press conference on the financial issues at your healthcare system. And I called our CEO and she said, wow, you don't give up. And I said, no, I don't. You gave me a challenge. I'm going to take it on. And so he did come. Ultimately, great story of the ending is that we ended up working closely with him. He introduced legislation that ended up becoming very impactful to us, helped us to maintain roughly $16 to $18 million over a period of years from a Medicare reimbursement consistently, and which was very, very important for our healthcare system and ultimately the patients that we served. And so what I learned in that was, those relationships that you built one day are always going to come back. You just got to continue to build them and sustain them.
That is so important. Wow. Great advice. And the applicability of that is vital. You never want to burn bridges. You always want to keep cultivating these relationships. So that makes sense why you were so successful there. And you were there for almost 9 years, right? When you moved on, though, you had a bit of a shift again, right? You shifted this time into education and you worked in education for a very long time after that as
Yeah.
well. Why did you go into education?
Yeah. So, like many people in hospital administration, right? I was certainly impacted by our healthcare system being acquired, and I always tell people that those experiences certainly are not the most positive at times, right? I had been there for as you noted, almost 10 years. The job that I held there was truly like going in every day and not working. It was truly a vocation, and I was also serving the community where I grew up and I felt like every day I was giving back. Ultimately, a larger healthcare system came in. Our board made a decision to move forward with that. Prior to that, our CEO, who I worked very closely with, who was my mentor and my coach for many years, moved on,
Mhm.
and I knew that it wasn't going to be a long term plan farther into the process. So, ultimately it was one of those decisions that, kind of came with some tough love. I did not really want to leave healthcare, but my options were very limited at the time as to where I lived. It was either to take a lesser role in the newer healthcare system environment or move to the competitor. But the competitor also, really was more interested in kind of what you'd consider in our healthcare world trade secrets because I had been on the other side for so long.
Yep.
And I also was not interested in that. As a person of integrity, if I'm going to go work somewhere, I've got to know that they're not just going to want to steal everything, but rather move on. And so I took a restructuring package that allowed me, some period of time to really assess what I would do next. And I'll tell you, the main reason I thought of academia was I had done a lot of work with academia on the healthcare system side from the employer side around workforce development, around new academic programs to support us. And what I felt was that academics really needed someone who understood the employer side.
Hmm.
And so, it became incumbent upon me to see if I could be a good voice and someone that could help to lead some of that change into that process. And I will say that in my time, certainly what I learned is I'm not an academic. I don't want to work in academia, permanently. But the experience of working in academia, both on the faculty side, but also on the executive administrative side, has really turned out to be very, very beneficial to me. It has allowed me to understand their challenges and opportunities, but it also has allowed me to be a bridge to bring employers and academia together. And not just in healthcare, but I've done it in advanced manufacturing, I've done it in finance, I've done it in so many different areas now that I have a better appreciation for kind of the whole process.
I think back to an article we were reading in an MBA curriculum, which is Leadership Lessons from India, and it discusses how one of the reasons India businesses invest so much in their workplaces because of the competitive environment, right? 30 or 40% turnover. And so compared to the US, they spend way more money on employee education and employee training. Why do you think it is so low in the US? What are those barriers that these institutions are having? I feel like you're the right person to ask about this.
Yeah. There's definitely a lot of barriers, right? I mean, if you look at it from the vantage point, if you just take healthcare as a whole and look at how much learning and development receive from a budgetary perspective every annual year in the fiscal year budget, it's a very, very low amount. Even at the largest healthcare systems in this country, if it reaches 2% or 3% of the budget, it's shocking. And, it's no wonder why we're dealing with retention challenges in the way that we are. Because to your point, ultimately the investment in learning in each and every one of our colleagues will serve our organization in the best possible way forward. And, I think in many ways, you will hear me say this and people will challenge me on this respectfully. I oftentimes will say, in a healthcare system space, this is why I've been so concerned that healthcare has grown too large. The larger a healthcare system has grown, it's sort of lost its identity and connection to the community that it serves.
Hmm.
And why that in my opinion is important is when I was at my healthcare system, we were of and part of and in that community. We were what I call an anchor institution. And for individuals in healthcare, I would encourage them to study the anchor institution framework. Because if you believe in anchor institution framework, you know that it's truly about partnership with everyone in that community. And so in our healthcare system, academic partnership, learning and development was a cornerstone of what we saw as a strategic asset. We felt it was not just the right thing, but it was the key differentiator to our competitors. And I think that this is where healthcare has become a bit too large. Now, I think the opportunity is really for CEOs and I'll say boards, because ultimately the governing boards, are also making big decisions on a lot of things and holding the executive responsible, need to come in and say, we prioritize people and development. And when we prioritize people and development, that means we invest in education. And so this is a space we've got to do that. Now, here's the other element to it. You heard me say I'm just returning from a global trip on apprenticeships.
Yeah.
We also can't just focus on education in the traditional means. We also have to focus on education in different ways. And so I'm the first to say you can't just tell people to go to college to serve in healthcare anymore. We've got to have work-based learning.
Yep.
We've got to have apprenticeships. We've got to have youth apprenticeships. And we've got to really create a new way of creating a healthcare workforce. And I think other parts of the world have benefited from that type of thinking. And the US has just been too slow and too risk averse. And so we've got to change it. And our numbers aren't on our side. And the time is also not on our side. And so we've got to be bold in this work. And I think, for all my colleagues that are in healthcare, if you're not thinking about this as a priority, you're truly, off the right wavelength.
I found this to be so true with my organization in that developing an internship program that actually really teaches interns valuable skills is extremely resource intensive, but you get so much back from it, not even in the work that they produce if they stay with your organization, but in the community impact.
Yep.
You are going to be recognized as a leader. And what's so interesting is, you said that your health system was acquired, and then now we know that same health system is being acquired once again, right, and forming an even bigger system. Sometimes I think that it's moves and counter moves, right? I mean, you look at some of the situations. A large health system from California, for example, moves into the East Coast, and they start acquiring some hospitals. Well, then some of the health systems here feel threatened by that, and they have to acquire others. I think it's challenging, right? Because don't you feel like there's a risk of, if you don't rapidly expand across the state or across multiple states, that you'll be then overrun by the other institution? I guess the real question that I'm asking: can this people-focused development, workforce development, community development, make you successful enough where you don't have to expand?
Yeah. It's a really good question, right? And I think we'll see as time proceeds, right? Because if you think about it, in that exact circumstance, right? St. Luke's is now a standalone healthcare system, and Lehigh Valley is now part of Jefferson.
Mm-hmm.
And if for those that have spent time in the Lehigh Valley, of which obviously I have in just the last few weeks, it's very clear how St. Luke's is marketing upon this, right? We're the only local healthcare system. We're the only healthcare system making local decisions still about you as the patients that we serve. It'll be interesting to see, right? This is where the US healthcare system is really challenged because it's all about the payer side of it, right? And so, to your exact point, that big system moving from California has got a big payer part of it. And if that payer part of it becomes part of their new healthcare systems, they're in a much stronger position than others. The question is whether Jefferson will be in a position to navigate that payer model, even though they have some stake in a payer model. Will it have the same effect in the Lehigh Valley and in Northeast PA?
We know that I work for the health plan, of course, but
Yep.
so I don't want to say anything unneutral, even though I work for them. But yeah, we know that internally it's a big deal, right? We want to provide the services to as many people as we can. We know that that's one of the goals that we have,
Yep.
and we do realize as well that it seems like this kind of totally integrated care network model is really important. But to your point as well, I do really worry about local communities in rural areas and how payer infighting can impact them. We've seen this in Philly with the Keystone Temple incident, right? We've seen mass confusion in our members, and
Yep.
even just in the public, if you speak with people in North Philly especially.
Yep.
These individuals are not the kind of people, most Philadelphians aren't, that can get in a car and drive 20 minutes to go to a hospital, right? These people need their local hospital. And that's something that I really worry about. So talking about workforce development again, though, right? It does make sense now looking at your resume how you were prepared to enter this role at Siemens, because you had the healthcare part, you had the education part of things. But how did you come to realize that's where you wanted to work? How did that role represent itself?
Yeah. So, I mean, obviously, just like most things, right, these days, it's all about your network. So, in my circumstance, our head of growth and innovation at Siemens in education and workforce solutions, who's really had a very critical role of supporting Siemens on all aspects of education and workforce. I had gotten to know him just through my network of educational work. And when he and our vice president, our previous vice president, who's now moved into a global role, were working to think about how would they continue to innovate and transform in this space. When they created this role, he had reached out and said, "Hey, I think this may be something you want to consider." And I will tell you, and obviously he knows this because we had the conversation, that there was a lot for me that was kind of like pause, reflect, pause, reflect, because I had never worked in the global medtech space, right? And as a hospital person, you hear a lot about the medtech space. And, you know, for me, the part that I truly wanted to understand and evaluate as part of the process to decide whether I would come on board or not was A, how serious were they really about this work? And B, was it truly a scalable concept? And, when I got to, experience the process, what it was clear to me was there was a lot of alignment on how crucial this work was and how important at the highest levels of Siemens, they viewed this. And to our earlier conversation, Siemens has been very innovative in a lot of other parts of the business in the workforce. This was sort of the first kind of tranche of how Healthineers would approach it, like other parts of the Siemens business. And that piece really intrigued me, right? Because as a global company, yes, my role is focused on US and Canada, but I have an opportunity with amazing colleagues, 16,000 or so in the US and North America, to make an impact in a space that could have a sustainable effect. And so that really is what really attracted me to say, hey, you know what? There's more for me to gain than there is for me to lose in this situation. And ultimately, there's so much for me to learn. And, it's been a really interesting, 1+ years thus far here. And I'll also say I've been super impressed with all of our executives understanding how important this issue is and really wanting to solve it in a sustainable manner. And so that piece has been really, really refreshing to see in the healthcare space.
Can you, and I love how you're so impact focused too. I think that from what I've spoken with people is that impact focused mindset leads to a lot higher satisfaction. And I can tell that you're very motivated about your job and satisfied with it. I love that. What are these sustainable approaches that you're taking? If you don't mind sharing a few that maybe our
Yeah.
audience could implement.
Yeah. So, you heard me talk about one, right? We have to move to a model of really work-based learning. And so we've been super engaged, with many healthcare systems around the country around, looking at this concept of apprenticeships and youth apprenticeships. We have to get more youth involved and engaged in our healthcare system much earlier than college. We've got to get them in when they're in middle school,
Oh,
have
really?
that journey continue through high school. And then obviously, the obvious question we have to ask is why in the United States in 2024 do we still require a student to decide between going to college or getting a job? Why can't they get a job and earn that degree on the job? That's what happens in other parts of the world. As I mentioned, I just got back from the UK. While I was in the UK, I had the opportunity at our Siemens MRI facility in Oxford to meet several of our employees that are apprenticeship degree employees, meaning they're earning their degree on the job while they work and earn a living. They have no student loan, no debt. Siemens is paying them a job and they're getting their degree covered, and their academic institution is validating all of it.
Hmm.
We can't continue to substantiate this divide of choosing between college and a degree in the United States. And so we've got to move that forward. So that's one example, certainly around apprenticeships and certainly around the apprenticeship degree. The other is really around, how do we as a nation and sort of at a national level really work to prioritize STEM based careers. And so, as you can imagine, Siemens has been very involved in this work for a very long time. But on the healthcare space, we're further getting involved and really making sure that when people think of healthcare, they think of this type of stuff: lab, imaging, radiation oncology, really, really important roles that without it, things just sit. If you can't get a lab test done, and get analyzed, if you can't get an imaging study done, the whole healthcare system just sits. And so, that type of stuff is super, super important. The other piece that's super exciting around this is, Siemens being the type of company that we are, we think about the whole longitudinal view of this. And so, we are very committed from an environmental perspective on reducing carbon footprint. That element kind of goes through the whole thread. And so all of our work, even in workforce development, has a sustainability factor to it.
Mm.
And so we're really getting to the heart in the work we do with our healthcare systems around the social determinants of health. We're looking at how do you lift up communities in their region around career and economic mobility. So I'll give you an example. In St. Louis with SSM Health, we've publicly announced work there to develop apprenticeships. And if you think about what's really unique about that is we have together decided to go into one of the most challenged economically parts of the city. and partner with community-based organizations to create a process where we can get these youth into these actual roles that will be paid, where they can do a job, earn an income, and ultimately then go on and get that degree. Because again, we don't have the apprenticeship degree yet in the US. And so we've got that hurdle. But they're going to earn an income. And these are young people that's parents have never necessarily even held a job.
Hmm.
Or if they've held a job, it's not a job that allows them to fully sustain and support the family. And so, we're trying to reverse that system challenge that's existing there so that we can try to move that community forward. And we're trying to do that type of stuff. And so, that work is not just to your point about impact, it's also about changing lives. And I think it's very noble when you have a healthcare system, in an organization like Siemens that want to go deep into the heart of those communities to want to do that. And I can't say enough about our leaders to be that caring and concerned about that, especially as a global organization.
I have so many, questions about this. I'll probably have to have you back on again sometime to answer all of them. But one of the ones that I really want to talk about is how these hospitals are at such a great place and a great advantage in a lot of ways because they have universities usually attached to them. They have programs for residency and fellowships, administrative internships. Can you just give me an example of that one you're talking about in St. Louis? You said it was St. Louis, right? What does that actually look like? What degree are they trying to get? What skills are they? Just so that we can have some more details on
Yeah.
what that looks like.
Yeah. So in the St. Louis example with SSM Health, we're actually really working to create sort of an imaging workforce pipeline. And so that would require, obviously, that today, under regulation and under licensure, they have to get an associate's degree first.
Mhm.
Certainly, you could get a bachelor's in imaging as well, but that's 4 years versus the 2 year. And then you have to get that associate's degree. You have to do your 1,400 in-person clinical hours, and then you sit for the national level certification exam in whatever modality you choose. Now, that's where we have inherent challenges because realistically, post COVID, we've lost about 30% of the imaging workforce nationwide.
Yeah.
And if you look at the data around our community colleges, more than half of them report being fully enrolled. But what's true there is they're not really fully enrolled. They only have a certain number of students that they can take because of faculty student ratio.
Yeah.
And so the challenge we have is we have such a demand, but we don't, we have such a supply and demand gap, significant challenge here. And when you talk to the community colleges, the hurdle is, under accreditation, they can only do a certain number of students to faculty that they have. And so, in that circumstance, obviously, we're focused on getting them into the healthcare system earlier so they get exposure, get interested, and then obviously they have to go on for their degree. But if you hear what I was talking about earlier, we've got to shift to a work based learning model. We cannot continue the model that we have in today, or we will never sustainably fix our healthcare workforce. And there are other healthcare systems doing this around the country. UW Health in Madison, Wisconsin is doing some amazing work with apprenticeships in nursing. They launched the first nursing apprenticeship. They're doing work in other parts of apprenticeships, really creating these sticky relationships that are going to ultimately have those students retain and grow their careers at UW Health. There are other systems looking at doing this. Memorial Hermann is doing some of this work and looking at nursing apprenticeships, among others. We're doing work with MUSC in South Carolina around imaging youth apprenticeships. And so, we've got to continue to move this model to this more work based learning because ultimately, when you're earning an income and you're learning on the job, why should that make a difference? Whether you're doing that in the classroom or you're doing it on the job. And those of us that have worked in healthcare know healthcare is the optimal space for learning because you're not only going to learn, you're going to learn on the best technology, you're going to learn in the most challenging environment, you're going to learn with other professionals. And I love faculty and all, but a lot of times faculty have not necessarily been around all of that in more recent time either, just because of the environment that we have in the US. And so that's the model we've got to move to.
It's so much easier in the business side of things to do that, right? Because there's not this regulation requirement. I mean, a lot of my coworkers here are getting their bachelor's degree while working full time. I mean, one of my coworkers has 4 kids. She has to support her family.
Yep.
That's what she has to do. And so, if it wasn't for that online option through Jefferson, she wouldn't be able to get her bachelor's, and then her career would be in a stall. So, it's challenging because, not to say that we don't need business people, but we really need these imaging people, right? I mean, there's a lot of business grads out there. And so it creates this diversity issue as well, where only the people who can afford to take 2 years or 4 years off, and in the community college case, right, they have to pay for their own housing a lot of times.
Hmm.
And so that's just not working. But I do want to probe a little bit more, and I appreciate your time. When we're talking about an ideal scenario where the regulations are changed, right? Let's say we could change the regulations in any way, based on what you've seen overseas. What does it actually look like for the intern or the apprentice in imaging? Are they working in imaging with one of the more experienced workers and then also doing their coursework?
Yeah. So the way it works, in other countries, and then I'll also talk a little bit about, sort of a new role that's being envisioned in imaging as well. So, ASRT, which is the Professional Society of Imaging, ARRT, which is the licensing board in imaging, and JCERT, which is the higher ed accreditor of imaging programs, recently released a white paper. And that white paper calls for a new role in imaging called imaging medical assistant. That new role is pivotal as it allows us to stack into that associate's degree. That'll be very transformational. Certainly important because it's also pre-licensure. So it allows somebody who does not have a license to work in a defined role in a hospital system. They could do basically everything except for do the actual scan. They can't hit the button because you've got to be licensed to do that. But they can certainly room the patient. They can certainly help with all those aspects. They can certainly observe the scan with the technologist that's actually doing it. And they can certainly do other aspects, blood draws. They can take blood pressure, just like a medical assistant would do, but specifically specialize in imaging. So there's new curriculum that's being developed for that new role. And certainly I applaud everyone that's been a part of that work because we have to have a stackable role. Now, to how other countries do this, right? I mean, so in the UK and in Germany and other parts of the world, look, this is a defined role, so they get hired into an actual role as an apprentice. They have a person that they're apprenticing with, whether that's their direct supervisor or another member of the team. They have a core curriculum that's developed either with the academic institution or by the employer with the academic institution or by the academic institution with the employer, whichever way works best. And then they both validate that. And so the academic institution will send faculty on site to validate it in terms of hours, validate it in terms of competencies, look at things from a growth pattern to see how they're learning and growing, just like you would in the classroom. Ultimately, it's the idea of a flipped classroom. If you really think about it, experiential learning has historically shown to be more, much more effective in this model. It's having the willingness and desire to think very, very different. The other piece that's super intriguing about it is we have significant faculty shortages in healthcare programs around the country. And so if you can have a model where maybe the healthcare faculty are actually also employed by the healthcare system and their faculty, we can move to a model where, because guess what? Colleges lose people all the time because they realize you can make more in hospital systems. And so if we can have a model where we flip it and we again have that great approach, we may also fix those things. And so, it's not going to be an easy change in the US because historically we've been more place-based in these types of programs, to your point. But the other piece is some of these students are doing online learning, to your point as well. They're doing those online learning aspects. And so you can arrange it so they do their online in areas where they can, and they do their hands-on in the areas where they can't do the online. It's a great model. And I will tell you, every single one of the students that I've spoken to that are in this across the various different employers and such in the country. I visited the NHS while I was there last week as well, talked with a bunch of nurses and other clinicians that are in this exact same model at the NHS in England. They're all ages, keep in mind too. That's the beauty of this too. What it's doing is it's transforming not just them, but their lives. And it's allowing the healthcare system to create this stickiness that allows retention to improve, and they're creating a workforce that's more sustainable. And look, I think the time is fresh, and we've got to move on this. And I was blessed to be a part of a really engaged group, and the U.S. Department of Labor was along with us, as well as others that really also want to see that something like this have an opportunity to advance forward. And I think the time we've got to move on it.
Really incredible points. I really hope that some of the people watching start to get their wheels turning on this a bit and see the massive space for opportunity. I know that I'm personally very excited about some of the things that you've been saying for my own organization, to see how we can implement these kinds of things and just become maybe a better advocate in the space. But really, really incredible points. And I see why you're in that role that you're in now. You're very skilled at this topic. So I couldn't be more appreciative for you coming on, Geoffrey. Really, really do appreciate it. And I hope we can have you on again in the future.
Absolutely. Thank you as well.
Of course.